And welcome again, another beautiful day for the Global Gratitude Summit. I'm Luann Saraga-Walters.
And I'm Sharon Saraga-Walters.
Very pleased and honored to have you, our guest attendees, back. And boy, do we have a really interesting and really rich program today. We're talking about gratitude as a tool against cancer. And our guest today is a doctor of osteopathy with multiple board certifications, including family, anti-aging, restorative and regenerative, nutritional and metabolic, and integrative medicines. She's a certified practitioner of functional medicine. She has a personal interest in integrative cancer support and prevention, and she's a member of the Adaptive Cancer Care Essentials Program, which is a highly esteemed and dynamic integrative cancer care training program. Dr. Tarin Forbes joins us now from Clearwater, Florida, where she's also the medical director of Massley Optimal Health Center, serving patients from around the world. Hello, Dr. Forbes. Thank you for taking time to be with us on the Global Gratitude Summit.
Hello, Luann. Hello, Sharon. And I am very grateful and honored to be a part of this.
Well, it certainly is a pleasure to have you. You know,
Yes.
we've had the pleasure in the past of working with you in a couple of different capacities, and your knowledge is so vast, and especially for this topic, which is really sensitive and also really meaningful to a lot of people. Getting the word of, I have a diagnosis of cancer can be a very, very scary thing for the person receiving the diagnosis and also the family members. So I know that you have had a personal experience with cancer, and I want you to be able to share that. I know we talked about that, but you've also had a really very personal, intimate, life-changing experience with gratitude. And if we can start, would you mind sharing that?
Of course. So about 7 years ago, I had gotten pregnant with my first child. I was newly married. I had always wanted to be a mom. So that was just the most magical time. And, you know, I felt the baby move, kick. We talked to her. We even had a name for her. You know, nicknamed her Peach. We didn't know if she was a boy or a girl. And 8 months into the pregnancy, I lost her suddenly, and they really didn't know why. We got to spend a day with her. Hospice was involved. I had a doula, and it was just such a beautiful day. But you can imagine giving her back at the end of the day was just absolutely heart-wrenching. And you know, my husband and I were absolutely devastated. And, you know, a couple months had gone by, and, you know, we had tried to get pregnant again and struggled. And one night, I'll never forget, we were laying in bed and our mindset kind of shifted, and we talked about our experience with her and how beautiful and magical, and how we were so lucky and grateful to experience that. And, you know, and we started thinking, telling people and sharing, you know, our experience and how grateful we were. And lo and behold, we got pregnant like that after really focusing consciously to be grateful. And one of my brother's patients, unfortunately, had suffered very similar loss to my own. And he called me up asking, you know, if I could talk to her. She was in California, and she was harboring a lot of resentment and anger towards God. Like, why me? Why did this happen to me? And I talked to her, and I talked to her about her experience. She got to spend the day with the little one. She was, you know, she had just such a happy, beautiful pregnancy. And I asked, did you love her? You know, and she said, oh, I did, more so than I, you know, ever knew I had that kind of love before. And it was just the most magical time. And I said, will you hold on to those moments and that experience? And, you know, maybe you can be grateful like I was grateful of my time, you know, with my little Peach. And it shifted. Her mindset shifted. She immediately started to think of that experiences of acts of gratitude, and she let go of the resentment. And lo and behold, she got pregnant, and she has two healthy, beautiful children today. So that really shifted things in my life, period, because I started realizing the power of the mind and power of the heart, and how acts of gratitude really have a physiologic impact on your body. And so I've shared that story with many of my patients. And you know, losing my little girl really shifted my career as well. I gave up rounding at 6 different hospitals. I stopped seeing 30 patients a day. I took off a day or two a week to focus on, my fellowship in anti-aging and regenerative and restorative medicine, and pursue, my board certification in integrative medicine. So she really shifted my career. So I'm forever grateful for, my time with her and how she's impacted me as an individual.
Wow. Well, and thank you for sharing that story. That's extremely personal. I can't fathom the pain of that, knowing that you were 8 months, well, in any pregnancy really, but here you were just on the verge of expecting to welcome her.
Yeah.
And you did welcome her, but not quite in the way that you had expected to. You said something in the sharing of that. It shifted your practice, but also as a doctor, with so many board certifications and such an awareness of all the different systems of the human body, you're one of those doctors who didn't necessarily just focus in a specific specialty, but you have a broad range of knowledge, which is really vast. And it's interesting to see how the medical practice is now going with that. But you mentioned the physiological aspect of gratitude. And so as a doctor, you can see, that shift. So I'm really grateful that you're here talking with us about the cancer aspect of that, and the research that you found for that as well. So, I want to talk about the research a little bit of that and how it's going. And we've got, we got another 40 minutes to play with this, but I know that cancer is also impactful to you. And I believe it was your father who had cancer. Is that right?
Yes. So my father was diagnosed with esophageal cancer 8 years ago, and they had removed his whole esophagus, and they thought they had gotten it, that it was curative. They had actually gotten stage A pathology results, which doesn't get much better than that. However, 6.5 years after that, he presented with 5 liters of fluid on his lung. And, he was pretty much given weeks to maybe months to live. And so I really, being part of A4M, and I had seen Dr. Mark Rosenberg, who is an integrative cancer scientist, and he's head of the Adaptive Cancer Care Essentials program that I'm a part of, but he's just cutting edge, world renowned. He's an integrative physician. So he takes a very multifaceted approach to cancer. And so, yes, I kind of delved into integrative cancer care and just to help my patients. And so that's where that journey began. And so, yes, gratitude's a part of that integrative cancer care. It's one of my big tools that I address with my patients.
You've got such a powerful combination of that, because you've had the personal experience with gratitude in your own life, and you've had the personal experience of losing someone from cancer.
Yes.
So this is perfect timing, and thank you for being willing to step into this.
Yeah.
Oh, thank you.
Thank you so much. What I'm experiencing right now is because I've had friends who've had cancer, but back then I really didn't think about the gratitude aspect of it. And talking about gratitude and cancer in the same subject, talking about it together, really interesting and important that we have that conversation. So thank you for that.
My pleasure. It's incredibly important, and it's really refreshing and exciting to me that some of these big institutes like MD Anderson, Harvard, Sloan Kettering are all talking about gratitude on their website and how it impacts their patients' resilience with treatment, but also their response to treatment and also their quality of life. So I think it's just hugely impactful that some of these big programs are getting on board with gratitude.
Wow. Okay. That was kind of like the question that I was wanting to ask was, you know, how have the studies addressed the effects of gratitude on our health and cancer and with cancer?
Yes. So the studies, you know, across the board, actually, in terms of studies with gratitude, it's shown to improve sleep, energy, fitness level, healthy eating choices, support, relationships, less visits to the doctor. So as it relates to cancer, the biggest comorbidities that cancer patients face are pain, fatigue, and depression, as well as decreased resilience. And across the board, the studies have shown that patients have increased resilience, decreased visits to their doctor, and now we're finding increased responses to treatment and therapy. It's interesting because cancer patients are at much greater risk of depression. And, you know, they're about 25% of cancer patients suffer from depression. Now, there's a study out in Singapore that looked at patients who were newly diagnosed with advanced cancer. And they measured their BDNF hormones, and they rated how their degree of depression, and then looked at response to therapy and to chemotherapy. And those who were severely depressed or more depressed did not respond well, and their time before death actually was greatly shortened compared to those who didn't suffer from depression. Now, we know from our studies that gratitude is inversely correlated with depression. So those who conscientiously focus on gratitude suffer an average of 50%, you know, at least 50%, they're less likely to develop depression. So if we can implement acts of gratitude in our patients, you know, right from the get-go, we can predict that they will be more responsive to their cancer therapies. So
and
it's
less
just
likely to suffer that.
That's
And less likely to suffer that depression, like you were saying. And so for those who aren't familiar with it, when Dr. Forbes is talking about inversely related, the more people practice gratitude, think of a scale. If you have this, you know, if the scale has more gratitude in it, then you have less depression. If you have less gratitude, you have more depression. And that's what those studies have found. So that's, you know, that we've heard stuff about laughter, right? And I've heard a lot of people talking about who've written blogs on cancer and whatnot saying, well, I had cancer, so I rented a lot of comedies, or I wanted to go be with my friends so that I could laugh, and kind of generating that same kind of feeling of the joy of life, the joy of being around this person, the joy of finding it. And sometimes it's really hard, depending upon your state of cancer or how you found out about it or where your life is, for a patient to say, well, I'm going to go rent a comedy. I don't feel like watching a stupid movie comedy right now. I have this. Yeah. So that practicing that tool is challenging. How can you recommend, or what do you recommend for somebody to try to really establish that practice? How is, you know, do you have some tools that you give to them, or how can they actually start implementing that so they can get the benefit, you know, of that effect?
Of course. So With implementing it, I want it to be simple and realistic for them to do. And it should be non-negotiable, meaning they should roll out of bed and kind of do it, just like an exercise. So, and also I provide them with like a heart math tool, which we'll talk, I think, further about that. But I tell my patients, roll out of bed, you do your workout, you do your heart math, you be grateful, you think with your heart. Takes 5 minutes to 10 minutes. Certainly, you know, my cancer patients, as they're a lot of them, many of them keep a diary too. So it's kind of second nature to them to pull it out when they're in, you know, getting their IV therapy or chemotherapy or their infusions, and they're journaling all about what they're grateful for that week. And it just takes 5 simple minutes, but it should be second nature to them, and it should be just habitual, because it does take practice.
I like how you say,
I love the practical device of the heart math because it's a biofeedback device, and so it can tell you if they reaching that brain heart coherence, and if you're improving your heart rate variability, which I think we'll be talking about a little bit further. So I don't want to spoil.
Sure, you bet. Well, you know, since I like how you say it's non-negotiable. It's just like an exercise. That's Sharon's big area. You know, graticize. That's the big thing. That's, you know, get up and do it and do it and do it, and don't get dismayed. Just like physical fitness.
Yeah,
that's your
really
go-to.
great.
Yes,
wonderful. So, what are some of the positive changes that you've seen by your patients who are practicing gratitude daily?
Yeah, what do you see when they've performed the gratitude?
So increased energy, increased overall sense of well-being. We actually track patients' DHEA levels, which is your hormone of overall wellness and libido. So we've seen improvements of that in as short as 30 days by doing practicing gratitude. Increased sleep, increased physical fitness, healthy eating, increased, you know, strengthening of the relationships. Those are all the things, and improvement, you know, just with their outcomes. I've seen, you know, my cancer patients in particular, who are practicing these acts of gratitude every single day, they're doing better. I know that's anecdotal, but in terms of, you know, what I see, that's what I see.
Well, I think it's important too, because anybody who is listening or watching this and may have or know of someone who has cancer, a little bit of life improvement, it's not necessarily, they don't consider it anecdotal. It's, you know, it's a great significant boost for that person's life. You know, I think it's interesting in today's world, in medical world, that we're really coming to understand that while we may have the genes that put us more at risk for cancers like BRCA1, and there may be certain genes that we carry that indicate we may get cancer, but we're not necessarily looking at it as a genetic disease. No. That they may have some other triggers, causes, that kind of a thing. So I know that you're both an integrative medicine board certified physician, as well as a functional medicine certified practitioner. How do those two types of medicines view cancer, and does that help you in working with your cancer patients?
So yes, I love both disciplines, and I hate to separate them both because I use them, you know, intertwinedly. Sure. And so integrative medicine is just a very multifaceted approach. It's a very holistic approach to medicine. And, it's coming at, the person with lifestyle measures, with meditation, with nutrition, with supplements, with stress management, sleep, acupuncture. So it's combining a bunch of disciplines to treat the patient holistically. And functional medicine is really getting down to the root cause of disease. We've known or Chinese medicine is known for centuries and centuries that a lot of diseases start in the gut. And only now has that's been the heart of functional medicine. So, Luann and I had the privilege and honor of, doing our course on Udemy with increased intestinal permeability, talking about how, most disease processes, if not all disease processes, begin in the gut. So in terms of cancer patients, as Dr. Mark Rosenberg says, it really needs to be an integrative approach to fighting cancer. And, cancer is a very complicated beast, and it is forever adapting and changing. And so it really needs to be a multi-pronged approach and not a silver bullet approach. And that's what integrative cancer care offers. Versus some of these one therapy targeted treatments, which can increase resistance. And sometimes it doesn't kill the cancer stem cells, which is like the mother cancer cells. So integrative cancer care, I think, is just the modality I want, on board with my cancer patients. Now, in terms of functional medicine and getting down to root cause we're seeing that everyone is uniquely different, and their cause of cancer may be different than someone else, and so it's a very, very customized, personalized approach to their cancer. So and why it started in the first place, and what we can do to get them back on track. So yes, hopefully that explained it.
No, that's wonderful. And you made me think of, I can't think of her name right now, but I will before the end of this. There was a woman who did her PhD on cancer, but she was actually looking at, it's called Radical Remission by Dr. Kelly.
Yes.
Anyway, Radical Remission.
I've read the book. Yep.
Yes. And
I'm blanking on her name too.
It was interesting because her research took her all over the world. Yeah. And what she was looking for were the common threads that tied people who had cancer remissions together. And one of those happened to be a practice of positive appreciation, I believe is how she termed it. Yeah. But it was the intention of looking at life in a different way. And not to say that that's what caused their remission, but that is a common factor in every one of the people who had a remission of cancer. That's something that she found, one of the 7. And it was interesting because in reading that book, and I highly recommend it, Radical Remission, every single person that she spoke with had a full-on exuberant life practice. It was a full out, and it wasn't I've been diagnosed with cancer, that's it. It was, and I love this from the friends I've seen who've been diagnosed with cancer, and some of our friends too, who said, and some of them had a greater response to it and a greater victory, and others not so much. But that being able to live your life fully and with gusto, that's so admirable and beneficial. And it was interesting to hear you in response to Sharon's question about that earlier too, talking about how you see that better rest, better overall feeling, those kinds of things. What are some simple tools? I think you touched on a couple, and we'll talk about heart math in a minute, but what are some other things that maybe you've guided people on in using gratitude? Because it's hard, Dr. Forbes, when you've just been diagnosed with, you went through that with losing your child. How do you intentionally have this mind shift? Gosh, that's, hey, just go smile. That's, you can't, you can't say that to somebody. So how do you speak to your patients about that?
So, well, that's why I love that bio feedback device, the heart math device, because it really takes time and practice figuring out what brings you to that nice brain heart coherence. And it's the imagery, and you just think over and over and over again. It's a muscle, and you have to exercise it. It's very hard, but yes, you want to do that, and you want to, you want to surround yourself with love. And I think with a lot of cancer patients, it's reprioritizing their life, and it's a hugely adaptive change. Realizing to let go of those things that don't really matter and focus on the love and joy that you have or have experienced, and focusing on that and those moments and making every single moment count. It can be life-changing. And, in the book, The Radical in Remission, it is all about radically changing their life, and getting rid of the bad soil in which the cancer grew in the first place. You need to change out that soil. So, shifting your mindset in terms of, you need to change your diet, need to change the way you look at life, and we need to get you moving. We need you to rest. We need to let you let go. But all those things can be hugely impactful. But yes, all those survivors, they were given months, if or weeks to live. Like, they were pretty much written off by their doctors, and they radically changed their life. And yes, those acts of like warmth and love and gratitude was really a practice that they all shared, which I think is phenomenal.
Dr. Forbes, what is your personal definition of gratitude?
Personal definition of gratitude. So, well, it is being thankful for either a past experience or someone who was in your life in the past, or being thankful and grateful for something that's going on in your life currently, or the loved ones that surround you, or it's an act of thankfulness or gratitude for your life to come. And also it's an act of thankfulness and being mindful in the moment, and just appreciating life, period.
Appreciating life, period. That was good. I know we put you on the spot, but that's a good summary. Past, present, future, and it's looking at those things that, in spite of everything that may be going wrong, there's something that may be going right.
Absolutely.
Right? Focusing on that. So we really want to thank you for taking the time to be with us and sharing your years of experience. I know your personal experiences, and really speaking to people who either have cancer or are concerned about having that as a risk in their families or going into remission. You have a lot of good information to give them from a scientific and also a personal knowledge basis. Thank you for that.
Yes, and thank you so much for sharing your story of your father and just how you're using that experience and that loss to your patients and helping them so much with gratitude with the cancer and beyond. Thank you so much for that.
Aw, it's my absolute pleasure. And thank you so much, you guys, you ladies, for inviting me and being a part of this summit. It's my honor, and I'm forever grateful for being a part of it. And yes, I hope to be a part of, this movement towards gratitude and the exciting research and studies to come, because I think it's only going up from here.
Thank you so much. And thank you, our viewers and listeners, and have a great day. We'll see you tomorrow on the Global Gratitude Summit.